Hi friends, welcome back to my channel. Today let's see another case note. How we can tackle it is, so let's read the case note. You are the nurse on shift at the maternity ward at Bill Hillary Public Hospital. Your patient is being discharged today. Patient details. Name Margaret Martin. Date of birth 31/6/2001. Admission date 23/12/2021. Discharge date 30/12/2021. Country of birth United Kingdom. Social background. Marital status single. Lived with boyfriend Josh Mario June 2020 to present. Current boyfriend 29 years. Verbally abusive 3 months. She does not want to live with him. He is not the father of child. Then, no contact with father of child, lives in Europe. Cashier, currently unemployed. Next of kin, brother, his age is mentioned, 26, married and overseas. Parents died one and a half years ago in an accident. And mother's side lives 4 hours away in phone contact. So let's move on to the medical history. No reported past illness or allergies. Tonsillectomy at 13. Nil alcohol or cigarettes. Depression since death of parents untreated. Obstetrics history. First antenatal visit at 14 weeks. Total visits 6. No complications. Antenatal supplements. Folic acid, vitamin D and calcium. Birth details are given. Presented in hospital at 19 hours on 23/12/2021. Vaginal delivery. First stage 8 hours. Contractions 1 hour and 15 minutes. Second stage 2 hours. Contractions 1 hour and 3 minutes. Date of birth 24/12/2021. Time 12:30 hours. Female. Weight is 3.77 kg. Then postnatal progress, minimal blood loss, hemoglobin is mentioned, breastfeeding with hesitation, prefers to change to bottle feeding. Body weight at discharge 3.95 kg, feeding well and normal. Let's go to the discharge plan. Refer to psychologist for emotional support and counseling regarding parents and boyfriend relationship dynamics. Refer to Women's Refugee Center for temporary. Advice to apply for single mother benefits, given brochures. Liaise with local maternal health service for ongoing postnatal monitoring. So what is the writing task? You are the nurse on shift at the maternity ward of Bill Hillary Public Hospital. Using the information provided in the case notes, write a referral letter to the manager of Women's Refuge Shelter, 21 East Street, INR 1998, London, where the patient needs to be admitted for short-term emergency accommodation and support services. So let's see an example. How we can write the address. The manager, Women's Refuge Shelter, 21 East Street, INR 1998, London. Then the date is 30 December 2021. Dear manager, reference Mrs. Margaret Martin. Date of birth 31 June 2001. How we can write the introduction? The purpose of this letter is to introduce Mrs. Margaret Martin, a postnatal mother. She requires emergency temporary accommodation and support services following her discharge today. The first paragraph, how we can write it? 1 week ago. That means today's date is 30 and she was admitted on 23. So we can paraphrase like that. 1 week ago, Mrs. Martin was hospitalized for delivery. She gave birth to a healthy female baby through vaginal delivery. Her postnatal period was uneventful with minimal blood loss. Then she prefers bottle feed to breastfeeding due to hesitation. Her baby's feeding is found to be normal. You notice why I didn't mention about the other things too. Because we are going to write this letter to the manager, not to a doctor or the nurse. And no need to mention about the medical history, that is irrelevant. And the social history only we will select the relevant information. And obstetric history also, no need to, it is not much important this time to provide the care. Only we are asking for some accommodation. So no need to know about these things, and he don't have much idea regarding these things. Then next paragraph we can write about the social history. Mrs. Martin is single who used to live with her boyfriend. However, currently she does not like to reside with him as he is verbally abusive for the past 3 months and he is not father of the child. She does not maintain relationship with the child's father. In addition, her brother is away and parents died in an accident. That's enough. Then we can go directly to the recommendation paragraph. In view of the above information, it would be appreciated if you could provide a shelter for Mrs. Martin. She was already seen by a psychologist in order to render counseling and mental support. Regarding family relationship issues, she is suggested to apply for single mother benefits since she is unemployed at present. An ongoing postnatal care is required by local maternal health service. Then the concluding paragraph. Please do not hesitate to contact me if you have any queries regarding Mrs. Martin. Then, as the name of the reader is not mentioned, you can write yours faithfully, registered nurse. That's enough. I think it's clear for you. And as usual, I'm telling here also, try to develop your own skills by doing some attempt. Don't copy the same from these case notes or don't copy the examples. You should practice by writing yourself. Thank you for supporting me and keep watching. Thank you. Bye.